Who are these people who walk around our communities all depressed, paranoid, anxious, disturbed? Maybe it's us. Are we mentally healthy? Next on Lakeshore Focus. Welcome again to Lakeshore Focus, a weekly show highlighting the key issues, important events, and interesting people in our region. I'm Keith Kirkpatrick. When someone has a sickness like cancer, diabetes, or migraines, we talk about it, educate, and support them through treatment. When a person has a physical disability such as loss of hand, not able to work, visual impairment, we talk about it, rehabilitate, and help them get an aid. But when another human being has a mental illness like depression, bipolar disorder, or schizophrenia, we don't talk about it, try to ignore it, and avoid. Let's meet a guy who can talk about mental health in a way that informs and educates, yet makes you laugh sometimes and self-reflect at the same time. Welcome Jake Messing, who is the Director of Behavioral Health at St. Catherine Hospital in East Chicago. Glad to have you on the show.
Thank you, Keith. Glad to be here.
Well, I know this is a subject that you can talk about all day long, mental health, right?
Absolutely. I believe it's one of my passions in life to educate people about mental illness and to shatter some of those myths and misconceptions that people have about it.
So what are some of those myths? I know that's a way you kind of grab an audience sometimes when you're talking. You kind of start off with those questions and facts. There's like, what do you believe, right? So what are those myths you shatter?
Well, I think one of them is that, the diagnosis of mental illness is some sort of death knell, that you will always have difficulties. The reality is that of all of the illnesses out there, I believe mental health illness is one of the most treatable. Really, the vast majority of people who have mental illness get treatment and respond really well to treatment. It could be your coworker, for all you know. It could be the lady sitting next to you. And that it really is exceedingly treatable. The difficult part is convincing people that they need treatment and that treatment works.
I know one of the other things you often do is you kind of say, look around the room, or how many of you out of how many fit this category. What are some of those questions you usually ask?
Well, one of the things I do, if I'm in a room of 100 people, I say the statistics say that 1 in 4 of the adult population has some sort of mental illness. So I ask those 25 people who have mental illness to stand up. And I usually get a lot of giggles, and very few people stand up.
And then you say, it could be you, the ones that didn't stand up, right?
That's exactly right. And I say, if I have to ask that question about who's left-handed, nobody has trouble standing up with that. It really highlights some of the stigma that people feel about mental illness.
And you're right, the left-handed thing's interesting, but if you ask people, how many people have broken a bone? How many people have had cancer? They would stand up.
Absolutely,
right?
They do, yep. There's a lot of shame and embarrassment that the average person has to admit that they're having mental health issues.
Well, why is that?
Boy, if I knew the answer to that, I would be a millionaire. I think, again, people don't understand what mental illness really is. I mean, it's fundamentally a brain disease, no different than diabetes being a pancreas disease, or a heart attack being a heart disease. That somehow there's this mythology that it's all in your head. Well, to some degree, it's right. It's all in your brain.
But you can't necessarily control that, or can you?
Oh, absolutely you can. There are lots of things that can improve our mental health or make it much worse, just like there's a lot of things that I can do to improve my heart or make it worse.
So oftentimes I think people think, okay, if I have a mental illness, I got to take some sort of pill. Now, I've got to probably take a pill that will chemically rebalance me or something. In what cases is that true? In what cases is it not?
Yeah, again, that's, I think, one of the myths and misconceptions, as the only treatment for mental illness is medications, when really there are lots of other therapies that are proven to be just as effective. Let me give you an example. Depression. We have research out there that says that cognitive behavioral therapy, which is a talk therapy, is as effective, or in some cases more effective, than medications. That same study says a combination of medications and cognitive behavioral therapy works best of all. We in the society want to take a pill to fix everything, and medications are wonderful. They really, really do help. But let's take a diabetic. My dad was a diabetic. If the only thing my dad did was take his insulin, and he ate a whole frozen cheesecake out of the freezer, and he stayed a couch potato, and he managed his stress real well, all the insulin in the world wasn't going to treat his diabetes. That, like all chronic illnesses, it's medication plus something else, usually lifestyle changes.
But sometimes it is some sort of chemical reaction in the brain, right?
Absolutely.
Is that for the more serious types of diagnosis?
Yeah, one of the things we believe, like again in all chronic illness, it's a combination of nature and nurture. You know, what's going on physically in my brain, and also what goes on in my life. What kind of stressors do I face? And some mental illnesses are a higher percentage of brain chemistry. Other illnesses are a higher percentage of environment, and I'll give you 2 examples. Schizophrenia, we believe, is almost exclusively a brain disease that is genetic. And the reason we believe that is that the rate of schizophrenia is exactly 1.1%, whether you live in Northwest Indiana, Kalamazoo, Michigan, or Bora Bora. It's exactly 1.1% of the adult population. That kind of tells us that environment doesn't play a huge role, that it really has to do with that gene for schizophrenia. The other reason we believe that is really the only treatment that seems to be effective for schizophrenia is medications, plus lifestyle changes, obviously.
So are people afraid? So we know about the medication, but are people still afraid to go see the counselor, go see the therapist?
Oh, absolutely. I think they're afraid. Because again, we as human beings don't like to admit there's something wrong with us.
Yeah, but we love to point out our scars, and we give standing ovations to people who are cancer survivors,
Right.
but we won't talk about these things. And we don't say, oh, by the way, I'm dealing with this issue.
Yeah, absolutely, although I'm seeing a slight change in that. One of the stories I tell people is I did private practice with teenagers for many years, and at the beginning when I would see these teenagers in the public, they got that deer in the headlights look because everyone knows what I do for a living, and I always say to them, I'll let you have the first move. If you want to ignore me, you're certainly not going to hurt my feelings. They didn't want to be recognized that they were seeing a mental health therapist, okay? But towards the end of my private practice career, I would go to a football game, and one of my clients would introduce me to their friends and say, hey, this is my counselor, Jake. He's a real good guy. He's helping me with da-da-da-da-da-da-da-da. And I thought, how cool that this generation is beginning to accept that it's okay to get help for mental health issues. Matter of fact, the older a person is, I think the less likely they are to do just that.
To seek help.
Yep.
My wife, being a school social worker, had one of those stories too. One of the, I think, 3rd graders walked in one time with her parent and said, oh, Mom, let me introduce you to my therapist.
Right.
And so, because she'd been talking to this little girl, and she thought it was very normal to,
Absolutely.
And who knows what her mom's reaction was.
Right.
So let's talk a little bit about some of the people who really have severe issues. And you and I were both at a speaker the other day that says he was talking about how the system really almost turns these people into dysfunctional people in the community or into homelessness, or because the support system is not there for the people who have serious mental illness.
Right. Yeah, again, it's a combination of a couple of things that make treating people with serious mental illness such a challenge. The first one, again, is that human nature thing that says, I don't believe that I'm sick, okay? So I may be working with somebody who believes that the FBI is spying on them through the electrical wires in the house. This is a true story. And the reason this patient came to our inpatient unit was because he was running around his parents' home cutting the electrical wires, live electrical wires with a pair of pliers, because he believed in his heart of hearts that the FBI was spying on him.
And he didn't see that as any sort of illness at all, right?
That's the problem, is he thought that was normal, and that, you know, what is our problem that we don't believe that to be true? So the biggest challenge we have in treating people with severe mental illness is convincing them that these things are illness and not reality, okay? And it's a real challenge to do that. This young man, for example, came to our inpatient unit several times. We would get him on medications, we would stabilize him, he'd go back home, he would do fine for a while. He'd say, I'm doing fine, I don't need to take these medications anymore, and then he would become psychotic again. And it took 2 or 3 or 4 hospitalizations with him before he finally kind of accepted and said, boy, I guess I really do have this thing called mental illness. Boy, I guess if I don't want to keep going back and forth to the hospital all the time, I really do need to stay with treatment. And the story has a wonderful outcome. He stayed compliant with medications, became very high functioning, went back to school, got a job, and I met him just by pure chance in the public working his job.
Wow.
And he had a huge smile on his face when he saw me, because not only was he working this job, he was the supervisor of his work crew.
But that's a success story, but there's a lot of failure stories.
Absolutely.
Because we see a lot of times, I think there's an assumption when you see somebody who's kind of panhandling or begging for money or even sleeping on the street, well, they're probably an alcoholic or they're probably a drug user, right? But some of these people are just seriously mentally ill. And
I would say that a good 50% of those homeless people that you see living under bridges are people with mental illness. And the other thing, Keith, is that mental illness and substance abuse often go hand in hand. You know, that frequently people can have both. If I'm somebody who's schizophrenic or I have bipolar disorder, would it be a big surprise that I might try to find refuge in taking something that makes me feel better? For some reason, with schizophrenics, they seem to be very attracted to smoking weed, of all things, which makes their illness so much worse.
you must have a lot of interesting conversations among the staff, people you worked at. You've worked in different places, different mental health facilities, which we've got many in this region. Mm-hmm. What do you guys talk about when you're not having a focus on clients?
Well, I think that one of the things we talk a lot about is how to sort of take care of ourselves working with this population, because that can be a challenge.
Yeah, because you hear these people's problems all the time, right?
Absolutely, and again, you know, I'll use my inpatient unit as an example. 80% of the patients who come to that inpatient unit are there on a court order. It wasn't their idea to come and get help. You see, if Jake Messing has a fight with his wife and I become despondent and I take a whole bottle full of pills and I end up in the emergency room, I will be going to the psych unit whether I want to or not, because I'm a danger to myself.
Right. So that's part of your conversation, is just like, how do you take care of yourself?
That's correct, and also what kind of tools work best in being able to help these patients that we deal with. And of course, our biggest tool is that magnificent tool of listening. And the best definition I ever heard of the kind of listening that we try to do came from a hospital chaplain I worked with many years ago. He said, true listening is the ability to climb inside the skin of another human being and view the world through their eyes.
Wow.
How awesome is that?
That is profound. So that's a good piece of advice for people who are out there who are interacting with people like that. So talk about a couple of scenarios here. So how about for our viewers who just, how do they deal with people who, are suffering, not maybe from severe, but just, having problems, and it's like, wow, this person's really out of sorts, and just, they seem so unhappy or whatever.
Right.
What can you do for those people?
I think, again, use that tool of listening, and listening is way beyond just saying, hey, how you doing today, Keith, okay? One of the things, again, that same hospital chaplain talked about, he said that 80% of communication is nonverbal. If I have a coworker who's normally gregarious and talkative and really likes to laugh and have a good time with me, and I run into a 5-day period of him in a row where he's sullen and he's not talking and he's kind of withdrawn and his body language is closed, and when I ask him how things are going, he mumbles a few words. Boy, I have all the information I need that something is going on with him, and I think that here's the hard part, is to take that leap to say, hey man, it looks like something's going on with you, that you're normally a happy, talky person and you look really glum today. Are things okay in your world?
So that's one of the things we need to do. You're saying we need to do more
Absolutely.
of, is just really try to listen. How does the average person who runs into this, so you and I are having this conversation, I'll let you be the person who's got the problem, okay? Mm-hmm. And so I finally have identified this with you, and you have admitted to me that, yeah, things aren't going well. How do I take that next step to maybe suggest to you, or how do I get you to seek help?
Yeah, I think, again, the message that I really coach people to kind of think about is that when people are having a hard time, especially with depression and anxiety, they believe that they're going to feel like this forever, okay? And one of the messages that I think we have to deliver in some sort of positive way is you don't really have to feel like this forever, that there are things out there that can help people to feel better. That one of the phrases I use all the time when I was doing therapy, and I would use this phrase with some of my depressed patients, is I would say, look, I know you have no hope that things are going to get better, but I have hope. So borrow my hope for a little bit of a time until you can find your own hope, and do some of the things that I know will be helpful for you to get through this icky feeling that you have.
So you have to give the person some level of hope then.
That's correct.
And do I then say you need to get some help? Or?
Absolutely. That this, I always say to people that being tough and pulling yourself up by the bootstraps is wonderful. There are times that you just have to do that to get to the end of your day at a hard day's job. But when people are suffering the symptoms of mental illness, toughing it out does not work. It really is needless suffering, in my opinion. And I think that's the other message that we have to deliver, is that despite your best efforts here, you're probably not likely to lick this one on your own, that you may need to get some professional help, that there are people out there who specialize in this and who can really be helpful to you.
So besides borrowing some hope, I could also probably say, let me help you find somebody or a place, because they may not take that next step, right?
Absolutely not. I mean, one of the things you can do is do some research for that person, to look up where are the local mental health centers, where are the counseling agencies in the area. They're easy to find. You can get them online. And
how about I'll go with you?
Absolutely, even better. I'll go with you for the first appointment, okay? Look, there are very few of us that don't have mental illness in our families. I certainly have. Despite my best efforts as being a professional, I have, some family members who I have basically...
I thought the rest of your family were going to point to you, perhaps.
Yeah, well, of course, yeah.
But a lot of people do, right?
That's right.
Even people who are in your field.
Absolutely. We're not immune from having mental health issues ourselves. And one of the things that I really pride ourselves in is if we recognize it with each other, that we reach out and help those people. Okay?
In fact, some of the best people doing therapy, treatment, counseling are people who've been through the same issues.
One of the things that I ask when I interview people for working in this field is, why do you want to work in this field? You know what the two most common answers are? I have a mental health issue, and boy, treatment really worked for me, and I want to be able to, impart that hope to other people. Or the even more common one is, I have a mom who's schizophrenic, or I have an uncle who's depressed, or I have a cousin who has bipolar disorder, and I was the person that was able to be helpful.
And you're saying both of those are good answers.
Those are wonderful answers.
Because that means I really care about this issue and want to do something about it to help others.
My nurse manager, who's a great guy, says that the one requirement you must have to work in this field is you have to have a soft spot in your heart for people with mental illness. Otherwise, the job becomes too difficult. And that people who work in the field for as long as somebody like I do, we really do have a special place in our heart with working for this population, that we really care about them getting well. We really will try to do that extra thing. I mean, I have staff that will pool money together to buy shoes for people who have no shoes. I mean, people will just do that little extra thing that may make the difference between somebody being successful in recovery and somebody not being successful.
Talk a little bit about how we as citizens, people living in the community, need to interact better with people who have, I mean, you walk along the street, you see somebody talking to themselves, you see somebody who looks totally withdrawn, sitting, doing nothing. And I think we avoid those people. I think we walk around them.
We're afraid of them.
We're afraid.
Yeah.
What do we need to do, really?
I think, like any other human being, we want to make our attempt to reach out and touch them. I mean, not physically, but with words. How are you doing today, sir? You know, and then just read reactions in people. Look, I don't want to be intrusive and make myself unwelcome in their world if that's their desire. But again, I think frequently those folks are just looking for some sort of contact. It could
Even
be
a
something
smile.
very.
Because I can imagine those people may sit on that bench all day long and not one single person smile at them.
Right.
And how would you feel if you sat there and nobody smiled at you the entire day?
Just acknowledge my existence, if nothing else, right? You know, and oftentimes that can be a conduit to something bigger. I tell people the story of how at a job that I was working, that I had one of these obviously pretty moderately mentally ill people walking around, and we had an unloading task to do that just required horsepower. I walked up to this fella and said, "Can I, pay you some money to help us out? We could use a helping hand here." And for a period of about 30 minutes, this fella just kind of helped out. He was glad for the $20.
And he felt valuable.
Absolutely.
He felt like somebody cares,
Yep.
and somebody thinks I'm worth something, and that's huge. We're down to really just a little bit here. So what is one thing that you just wish people understood about mental health?
I think the most important message that people can understand and deliver is that mental illness is common. It's nothing to be ashamed about, no more than diabetes or heart disease. And it's exceedingly treatable. That if people comply with treatment over the long haul, they're likely to live productive lives. Okay. And that's the challenge.
Well, I really appreciate you being here, and I more appreciate all that you do and the dedication you give and all the other people who are like you. So thanks for helping those who need help and being in our community. Thanks for being here today, Jake.
Yep, thank you.
Quite a few years back, a well-known and highly respected woman in our community died. The shock was it appeared she had committed suicide. Here was someone who knew all kinds of people, was actively engaged in the community, had many leadership roles, was admired by her coworkers, and seemed to always have a smile on her face. No one seemed to understand why it happened. Even her family were stunned, and it appeared that no dysfunctional or stressful circumstances existed in her home life. How does a person who outwardly has the appearance of happiness and success decide to take her life? I remember thinking there must have been something inside her brain that was not working right. Was she suffering silently with some mental malady no one could see? No one in their right mind would kill themselves when their life is pretty good, but she did. When an event such as this takes place, There are discussions where people are looking for answers. Most of the time, after lengthy analysis, you will hear people conclude that there were signs. How did I not notice that? I do remember him saying this or her doing that, and I thought it was odd or out of character. Why didn't I do or say something? Then comes our excuses, denial, or guilt. Instead of those worthless emotions, how about learning from our mistakes? Obviously, pay closer attention to what is going on with other people. I know your life is so busy and work so demanding that you have no time to devote. Well, make the time. When you use that standard American greeting of, "How you doing?" wait for the answer. If you get the normal response of fine, just say, "No, really, how are you doing?" and let them talk. Watch for those small or subtle changes in behavior. When you notice them, describe the difference and ask, "What is going on with you?" You won't always get an in-depth answer, and it may take a while for them to become comfortable enough to talk openly. Yet, people will eventually respond to someone who truly cares. The simple act of recognition and a willingness to listen may be that moment where another person is able to share their burden. You may never know the impact you made. On the other hand, you may save a life. Thanks for watching our show. It would be wonderful to find out what you thought about it. You can reach us through our email address, focus@lakeshorepublicmedia.org, or our website, www.lakeshorepublicmedia.org. It's also simple to find our previous shows online. Just Google Lakeshore Focus and my name, Keith Kirkpatrick. It's somewhat like pulling a lever on a slot machine. You never know what will pop up to watch. Be sure and join us again next week for another Lakeshore Focus. Until then, I'm Keith Kirkpatrick saying, make a positive difference in our world today.